A warm welcome to today's talk, Friday the 18th of March. Now, today we're going to be looking at Omicron BA.2, which is taking over the world. Basically, it's becoming the predominant strain. The number of infections in the United Kingdom now, as we speak, is higher, the prevalence is higher than it ever has been at any time in the entire pandemic, such as the transmissibility of Omicron BA.2. Now in Denmark, they're just coming out of their Omicron BA.2 wave and numbers are going down quite nicely. In the United States, where BA.2 is still going up, we will see an increase in infections in the United States over the next few weeks. This is quite inevitable. Now, how serious this is, we don't yet know. It's looking like people that have got immunity from Omicron, the original Omicron, are going to enjoy high levels of immunity to Omicron BA.2. It's looking like people that get Omicron BA.2 are going to enjoy high levels of immunity to potentially, and I believe, any future variant. So this could be remarkably good news. In the short term, we are seeing some increase in hospitalisations in the UK. It's not massive yet, but some. But we are seeing no increase in deaths at the moment, so we hope it's going to stay that way. And this is going to give us huge amounts of natural immunity, which we believe is the optimum form of immunity. Now, moving on to look at the evidence for this, new daily confirmed cases of COVID-19 per million people. So we notice that this green line here is Denmark, and the Omicron wave caused a huge number of increased infections in Denmark. And this is actually cases because in Denmark they were testing reasonably well, but it's a good proxy of infections. But now going down really quite nicely. So we see that they've been through this wave and now they're coming out the other side, which is pretty encouraging to see. And I would expect the UK to follow this pattern in the next few weeks. And then after that, I would expect the United States to follow this pattern as well. It just depends on when the infection got there, how the wave pans out. But the actual shape of the waves will be fairly similar. So that's Denmark. Now, New Zealand, of course, we're seeing increasing cases. Germany increasing. As we say, Denmark coming down. Australia, cases going up, largely due to the cases in Western Australia, which has just opened up, as we know. Eastern Australia already fairly well protected from community or herd immunity. United Kingdom cases going up. Canada and the United States, they're going down. Now, these, of course, are the cases that are the infections that are detected. And how many will be detected depends on how many tests we're doing, of course. But it's inevitable that infections are going to rise in the United States over the next few weeks. That is certainly going to happen. So let's just look at that, actually. This is the United States here. Week beginning the 11th of March, BA.2 is 23.1% of all COVID cases. Now, of course, we're a bit on from that now, but that's the latest data we have. Just 2 weeks before, week ending February the 26th, it was 7.1% of cases. So we can see, according to CDC data here, that it's trebled in the last 2 weeks, and I've no reason to assume this won't treble again in the next 2 weeks. So we're going to see an increase in cases in the United States, absolutely inevitably. Looking at the variants, of course, Omicron. Now, unfortunately, this doesn't give us the breakdown between BA1 and BA2 Omicron. Canada, Denmark, we know, is all BA2. The United Kingdom is now predominantly BA2. And the United States will be tipping from BA1 through to BA2 pretty soon now. And if we look at the R values, this is reflected. So what we see is that in the United Kingdom, the R values increased quite dramatically, and this is even based on fairly scanty testing, as a result of the increased transmissibility of the BA2 variant. This is what the BA2 variant will do. It will cause these kind of increases, very rapid increase, but hopefully a fairly short-lived increase, as we've seen in Denmark. Hospital patients in Denmark, still an increase because there's a lag effect, still that lag effect. In the UK, they are starting to go up somewhat. Canada, Australia, United States, this is the United States line here, gone down quite dramatically in the United States. Now, will we see a blip upwards in the United States as a result of BA2? Yes, probably, but I'm not expecting it to be big because there's so much community immunity around at the moment, which is, of course, exactly what we hoped for. So these are patients in intensive care. Germany, well, it's bobbing along about the same in Germany, but Canada and the United States have gone down dramatically. I mean, again, the United States had so many. It's gone down so dramatically in the United States. United Kingdom, tiniest of uptakes in the United Kingdom, but very, very little. Denmark and Australia, both with low numbers of patients in intensive care. And this indeed has characterised the Omicron wave. Very low numbers of people in intensive care. I've just put this one on for deaths so we can see it in some sort of context with the different waves. So this would be the original strain here, March 2020, the Wuhan strain. Then this is mostly the Alpha, very high levels of hospital. That's actually the United Kingdom data there, very high numbers of deaths in the United Kingdom for that short period of time. These are Delta times and these are Omicron times. But as we see now, the deaths, Denmark going down as we would expect, the United States going down, Germany flat, United Kingdom, New Zealand, Canada, Australia in that order. Deaths going up somewhat, we see there in New Zealand. But because it's a highly vaccinated population, that number of deaths is thankfully relatively low. Now here we're looking at the COVID symptom tracker data for the United Kingdom, and we see that nearly 3 million people are currently infected. This is the highest it's ever been at any time in the pandemic. We actually have more infections in the UK now, today, than we have ever had in the pandemic. Thankfully, the effects are so much less because of the high levels of immunity in the population. New daily confirmed cases, well over 250,000 on the day, 282,000. And if we see this graphic here, we can see that the cases are the highest they have been. So we are at very high levels of cases at the moment. And let's just run through some of that data actually. Now the headline here is COVID cases rocket to new high, which is absolutely true. This is the highest that they have ever got to. March the 18th, that's as of today, 258,000 new cases yesterday, an increase of 47% from last week. So last week it was 175,000, 47% increase. There's been a real dramatic increase in the number of infections, symptomatic infections reported, and this is reflected in the R values. So UK 1.2, England 1.2, Wales 1.2, Scotland 1.1, all increasing, of course, at the moment. Hopefully not for very much longer, though, just as BA2 goes through the people that are still not fully immune. And we know there's a lot of breakthrough infections, of course, from previous vaccination. And this is transposing into a prevalence of 1 in 24 in the United Kingdom currently with symptomatic COVID, remarkably high. It's rising in all regions of England, it's rising across all of the age demographics, and it's also rising in the older, more vulnerable age groups. And this is based on 840,000 reported symptomatic users and 54,409 tests, so based on pretty good data. Now let's just have a look at some of this Zoe data in a graphic form briefly now. Here we see that here. So here we see the sharp increase in cases over at this end here. Highest they've ever been. Recent sharp increase, BA.2 driven. Increased rates by English region, so we see it's increasing in all parts of England. It is happening everywhere. Now this graphic is showing the incident rates in the home countries. So this is Wales increasing here, Scotland increasing, England increasing. Northern Ireland is starting to increase, but not so much. And I think what has happened here is that BA2 became prevalent earlier in Northern Ireland compared to England, Scotland and Wales. So we're seeing a less dramatic effect there, although it's still higher. A less dramatic change, although the numbers are still higher, because BA2 has been there for slightly longer. So it's all still quite explicable in terms of BA2. And here's incidence by age groups in the United Kingdom. And again, we see that all age ranges are increasing. Now, we haven't seen these increases in the older demographic for some time, but now we're definitely seeing it. So these are the ones that could transpose through into more serious cases, and potentially, in fact, there will be some increase in hospitalisation. But at the same time, of course, it's all going to massively increase community-based immunity. So let's see what Professor Tim Spector is saying about this before we look at the Office for National Statistics data. Lead of the COVID symptom tracker study, of course. COVID cases are now at the highest level in the Zoe COVID study that the Zoe study has ever recorded. So the highest levels we've ever had in the pandemic in terms of prevalence. There is a rise in people aged 75 and over, that is the problem. These are the ones that could be hospitalised, and indeed in the slightly younger age range as well. But do bear in mind, still the average age of death in the UK from COVID is 82.5 years. So this is still the older age group that's being primarily affected. The data shows this pandemic is definitely not over yet and is more unpredictable than ever. Now, given that it's unpredictable, we can't really say that it's become endemic yet, because it's part of endemicity is predictability. So we're kind of, well, we've been saying this for a long time now, but the unpredictability indicates that we're not fully endemic yet. I would expect we are fully endemic soon, but technically we are not yet. Despite government measures to despite government messages to the contrary and lack of public health advice. And of course, we could argue about what that health advice should be. I can't tell you what to do, but natural immunity is remarkably effective. We do know that from many studies that we have just looked at. Now, let's look at some Office for National Statistics data. This is from week ending the 12th of March, because it's always a bit delayed. But even then, England 1 in 20 people currently infected in the week. Wales 1 in 25. Northern Ireland 1 in 14, because, as we said, BA2 was there earlier. And we know that BA2 is now the predominant variant in Scotland as well. We do know that now. But we also know that Scotland have been taking more stringent precautions than England, for example. And we see that Scotland, which has been taking more stringent precautions to try and prevent the spread of Omicron, has a higher prevalence. And this is consistent with the idea that Omicron, and especially Omicron BA2, is very hard to stop, and indeed is probably unstoppable. So we see, at least from this data here, no benefit at all in the increased restrictive measures and mask wearing that have taken place in Scotland. Deaths, the risk of death involving Omicron variant was 67% lower than the Delta variant, which of course is good. Now let's just look at some of this Office for National Statistics data now. So here we see the increase in the percentage testing positive in England, and this could carry on for the next week or two as BA2 becomes predominant, or the effects of the predominance of BA2 becomes manifest. Scotland, again, we're seeing the effect of BA2 there kicking in and increasing cases. Northern Ireland, where BA2 has been there for some time, the cases are remaining relatively high. Are we starting to see a slight drop off already? It's too early to tell, but we will do fairly soon. And I'm saying we will do fairly soon based on the evidence from the Danish data, and indeed the South Africa data, where the cases have dropped off after the Omicron wave. Now here we see the evidence here, Northern Ireland. Now this is BA2 here, and this is BA1. So we see that BA2 is increasing as BA1 is decreasing, both Omicron of course, but it looks fairly clear there, doesn't it, that BA2 is replacing BA1. England as well, and again this is after the 9th of March, remember, so this is already a bit out of date. But again, we see that BA2 is increased, BA1 is decreased, and we see the same in Scotland. And of course, this is timed pretty well, perfectly, with the increase in cases, supporting the contention that we're making that BA2 is responsible for the surge that we are now seeing. Age groups 50 to 69, some risk of hospitalisation, slight increase in numbers there. So this does increase the risk of the population as a whole for increasing hospitalisations. And again, in the 70 plus age group from Office for National Statistics data, a slight increase. And we've actually seen from Tim Spector's bang up to date data that this trend will be continued, and this will be reflected in the Office for National Statistics data. Now, I'm not going to go through all the parts of the country, but that just shows that even a week or two ago, as of the 12th of March, all areas of the country were increasing in people testing positive. Hospitalisations have increased a little bit, well, a fair bit. I mean, they're still manageable levels of hospitalisation, but they have increased. And we did anticipate this because a small proportion of people with Omicron will still be hospitalised. It's just a much smaller proportion than it was with previous variants. Hospital admissions, we still see. Now, there is some hospital admissions there in the 0 to 4s. We do believe that these are mostly precautionary. But apart from that, we see the typical older age groups being hospitalised much more, of course, as we've come to recognise, and likewise for deaths. Again, deaths occurring predominantly in the older age groups from the Office for National Statistics data. And here we see the deaths from the different waves. So this is the Wuhan wave. This is the Alpha wave. This is the Delta wave when immunity was much higher, and this is the Omicron wave here. In fact, yeah, that's the Omicron wave there. And the reason deaths are higher there is just because there's been so many more infections. So even though a much smaller percentage of people are dying than compared to Delta, the sheer numbers, of course, that increase in deaths in the UK. The comorbidities basically unchanged in that order: diabetes, respiratory conditions, high blood pressure, urinary system, ischemic heart disease, and people with no other reported cause of death on the death certificates. Comparison-wise, despite high infections levels, hospital admissions and deaths remain lower than during the second wave peak. So here we're seeing Alpha becoming dominant, Beta became dominant, Delta became dominant, and Omicron became dominant. So infections in the Omicron era, of course, we're seeing a lot more. Hospitalised admissions, again, we are seeing some now, more than during Delta because of the sheer numbers of cases, less than Alpha because of the immunity. And deaths relatively though, although there has certainly been some increase just due to the large numbers of people that are infected. So there we go. We are seeing some increase in hospitalisations and some increase in deaths because of the very large numbers of people being infected. I'm not expecting this to change government policy, because I don't really think the government are going to go back to lockdowns. I mean, well, we know they're not. And we know that's not going to happen in the United States either. So we just have to bear in mind that while we pay this cost of increased hospitalisations and deaths for a short period of time, we are expecting it to be short-lived, as we saw in the South Africa data, as we've seen in the Danish data, as we will see in the next week or so in the UK data, and then as we'll see with a delay in the United States data. And BA2 will become the global dominant virus, and that will enter us into the endemic stage, I firmly believe. So although it's slight sort of death throes, if you like, of the pandemic, probably a bad way to describe it, but the residual effects of the pandemic, I'm still very hopeful about entering into a prolonged endemic period really quite soon. Thank you for watching.